You see, the first breast cancer was published about 5,000 years ago. And between that time point and 1970, nothing, really nothing influenced the diagnosis and treatment of breast cancer. What happened in the 1970s was the detection, development of low-dose film screen mammography. And that opened an entirely new era, early detection. So while women brought their advanced carcinoma to the attention of their physicians for 5,000 years, and the mortality, the death rate was extremely high in these very advanced cancers, suddenly the mostly palpable cancers have been replaced with mostly non-palpable cancers. That's a huge difference. But of course, very strict, well-planned scientific trials were needed to prove that indeed finding breast cancer early is cutting back on advanced cancers and cutting back on mortality from breast cancer. And one of the largest and trial, so-called randomized control trial, was carried out in Sweden, where I was one of the co-directors of the two-county Swedish trial. And in 1985, we published our seminal paper, which showed that in women who were invited to screening, there was a 31% significantly decreased mortality from breast cancer. And that opened an entirely new branch in medicine, early detection of breast cancer. It influenced treatment, and it opened for population-based screening. So courtesy, all these accomplishments in a single physician generation, women are not dying from breast cancer to the same extent as they used to. Quite recently, we published an article in Cancer, in which we showed that we have a 60% decrease in mortality in the county where I work. And then we extended our research to 9 other counties. That is more than 500,000 Swedish women. And indeed, the mortality decrease in, let's say, 40% of the country is about 50%. This has never happened in the past 5,000 years. So we can be very happy about this, considering one of the most important accomplishments in cancer research in the past 50 years.
Interview.
Well, I really don't like to use the word screening, because there is poor screening and there is high quality screening. I like to use the word early detection. So the future life-saving effort for women is going to be early detection. But because breast cancer is a very heterogeneous disease, there will never be a single method that is going to find all the cancers with the same accuracy, sensitivity. So therefore, the future of early detection, or if somebody wants to use the word screening, is multi-modality screening. Everybody knows that there are women with fatty replaced breast and there are women with dense breast. Of course, cancer, pretty sizable, even palpable cancer, can be hidden in very dense breast. But we have the tool. It's called automated breast ultrasound. So mammography must be combined with automated breast ultrasound for women who have dense breast. In addition, there are women who inherit these cancer genes, BRCA1, 2, and so on. Those women need extra surveillance. I don't like to use the word screening because these are selected women out of the population. They need multimodality approach to screening more often, and also sometimes even MR. It is, however, very important for all the diagnostic and team members to understand that you're not treating an advanced cancer, that we are not treating an early non-palpable breast cancer the same way as we are treating an advanced cancer. And in this transition period, unfortunately, there are two aggressive treatment methods used for these baby cancers. The comparison is that you treat big grown-up criminals in one day, and you don't treat newborn babies the same way. So overtreatment is a huge problem.